So now that Julie has explained how we assess the microsystem, I'm going to go ahead and explain how we performed our literature review. Before looking at evidence-based practice, we knew we needed to find some sort of tool that was being used in the hospital setting to alert nurses and other clinical staff of patient diagnoses. The majority of the studies we looked at were based in infection prevention, so I'd like to give you a brief example. On the next slide, you're going to find our patient, Tom. Tom was admitted to the hospital due to an infectious disease process. Upon admission, the admitting nurse went ahead and posted that orange sign. This sign is going to indicate to anyone entering the room that A, Tom has an infectious disease process, and B, anyone who is entering needs to put on personal protective equipment such as that yellow gown or blue gloves in order to prevent the spread of infection. This is just a brief example about how signs are being used in the hospital currently. More studies that support the use of signs indicate that even though signs are not mandated to be used in the hospital setting, hospitals frequently use them because they improve compliancy with personal protective equipment. Additionally, studies showed that missing or delayed posting of signs had a significant impact on compliancy of using personal protective equipment. So after reviewing these studies, we decided that a sign would be most beneficial in alerting the nurse or clinical staff of the patient's heart failure diagnosis. In the bottom right corner, you'll find our main heart failure door sign. The large red heart indicates that the patient has a diagnosis of heart failure. So this is our main tool we use to alert the staff that the patient has a diagnosis of heart failure. The four icons on the right side are tools that we're using to prompt the nurse to complete various actions. On the top right corner, you'll see somebody using a computer. This icon is indicating that the nurse needs to use the computer to chart within the patient's electronic health record. The second icon is of somebody using a booklet. This icon indicates that the nurse needs to provide the patient with a heart failure education booklet and educate daily. The bottom two icons are of an I and an O and a scale, and these two icons indicate that the nurse needs to collaborate with their aide in order to obtain accurate intake and output and daily weights. So as you can see, the sign is utilized to A, alert the nurse of the patient's heart failure diagnosis, and B, prompt the nurse to perform various actions to promote the heart failure standards of care. In order to educate the nurses about the new sign, we utilized in-services during day shift and night shift to educate them about the meaning of the sign and what was expected when signs were utilized on the floor. Additionally, students presented updates at various unit-based council meetings to discuss the progress of the project to clinical staff and receive their feedback in order to strengthen the project.